Taiwan has added 2 more COVID cases linked to the China Airlines cluster. One is a pilot who received 1 dose of the AstraZeneca vaccine on April 22nd, but still tested COVID positive on May 4th.
The other case is a flight attendant, the first flight attendant to be affected by China Airlines outbreak.
Case number 1153 is a Taiwanese male in his 30s who is a pilot for China Airlines. He was in the U.S. on assignment between April 16th and April 18th. After returning to Taiwan, he quarantined at home until April 21st. He was tested before completing his quarantine and the test came back negative. He was tested again on April 25th under a special program for pilots, and his RT-PCR test and an antibody test came back negative. But on May 1st, he began experiencing a fever, cough, and runny nose. The health authority then arranged for him to be tested. His infection was lab confirmed today with a CT value of 13. Case number 1154 is a Taiwanese woman in her 20s and a flight attendant for China Airlines. She was in the U.S. on assignment between April 22nd and April 25th. After returning to Taiwan, she quarantined at home until April 28th. She was tested before completing her quarantine and the test result was negative. On the evening of April 29th, she was sent to a centralized quarantine facility. She was tested again on April 30th and her RT-PCR test and an antibody test came back negative. On May 2nd, she experienced a slight fever, dizziness, and a stomachache. The quarantine unit arranged for her to get medical care. Her case was lab confirmed today with a CT value of 14.
The Central Epidemic Command Center said that the 2 cases had personal contact prior to their diagnosis. The pilot had been with the flight attendant at a bar in Songshan district in the early hours of April 29th. The flight attendant was recalled for the extended quarantine on the evening of April 29th. Officials have not yet determined whether one infected the other or if each was affected by a different source in the United States.